This is the Coronavirus Global Update on Wednesday, the 25th of August. I'm Valerie Sanderson. Evidence from the UK suggests the effect of vaccines starts to reduce within 6 months. A report into the origin of the pandemic is handed in to the White House. And Vietnam offers recovered patients money to stay on in hospital. New research suggests the protection given by 2 doses of the Pfizer and AstraZeneca COVID vaccines starts to wear off within 6 months. The findings come from the Zoe COVID study, one of the largest real-world investigations, which looked at more than 1 million positive test results. Sophie Hutchinson reports.
This large-scale study found the Pfizer vaccine seemed to reduce from 88% to 74% over 5 to 6 months, and AstraZeneca from 77% to 67% over 4 to 5 months. Importantly, this is about protection from a COVID infection. Hospital figures suggest that both vaccines have continued to prevent severe illness in many people. However, Professor Tim Spector, the study's lead investigator, said protection against infection could drop to 50% by the winter and boosters would be needed.
The BBC understands that a review ordered by the US government into the origins of COVID-19 has been delivered to the White House. Media reports in the US say the review hasn't been able to come to a conclusion about whether the virus emerged naturally or as a result of an accident at a lab. A public statement summarising the conclusions is expected in the coming days. A public statement summarising the conclusions is expected in the coming days. The World Health Organization's director in the Western Pacific region says COVID surges, driven in part by the Delta variant, are pushing the health systems of some countries dangerously close to capacity. Takeshi Kasai warned that a red line is being approached where the number of critical cases exceeds intensive care capacity in hospitals. Mr. Kasai told an online news conference that the proportion of global cases from the Western Pacific region had jumped from 2% to 10%.
Getting priority populations, especially health workers and older people, and then whole communities, vaccinated as quickly as possible is crucial. But equally critical is continuing with the personal protective behaviors and public health measures that reduce transmission. Using these tools in combination is the key to limiting spread and the virus ability to mutate into more dangerous variants.
Japan has expanded a virus state of emergency to 8 more regions as rising infections put hospitals under pressure. School summer holidays are ending and some experts have suggested delaying the start of classes to reduce risks. The state of emergency largely limits the sale of alcohol by restaurants and bars and asks them to close early while urging the public to work from home and to avoid non-urgent outings. Officials in New Zealand have criticised as gutless some racist comments made amid the current outbreak in the country. As 63 new cases were recorded, it emerged that a large number of recent infections affected the Samoan community. Director General of Health, Ashley Bloomfield, updated journalists on their investigation.
There are some cases that are identified who have been at a location of interest. In the vast majority of cases already, we are able to identify that link, and the exact person-to-person link is still being elaborated. As I said yesterday, a large proportion of the cases in the outbreak are of Samoan ethnicity.
Vietnam is offering patients who've recovered from the coronavirus a monthly allowance if they agree to stay on at hospitals to help health workers. Vietnam is facing its worst outbreak yet, and medical facilities are struggling to cope. The Reuters news agency reports that participants will be given personal protective equipment, food, accommodation, and a monthly allowance of $350. Stay safe. That was the Coronavirus Global Update.